Hello and welcome to Innovations in Dermatology. I'm Dr. Hansa Bhargava, Chief Medical Officer of Medscape Education, and I'm really excited to have Dr. Lily Talakoob join us today as our keynote speaker. Dr. Lily Talakoob is a board-certified dermatologist and a fellow of the American Board of Dermatology. Prior to starting her own practice, McLean Dermatology and Skincare Center in 2009, she served in the Office of the U.S. Surgeon General. Regularly an industry expert in the media, Dr. Talakoob is a frequent guest on local and national television networks and contributes to a variety of national publications, including Allure, Glamour, Vogue, InStyle, Marie Claire, Harper's Bazaar, Brides, Shape, Parenting, Self, and more. She started Dermatodor in 2019, an e-commerce skincare store and app to take the guesswork out of choosing and using the right products based on each person's individual skin types. In 2021, Dermatodor launched the Tele Dermatology platform and app with an AI face scan feature, enabling a network of dermatologists to provide product recommendations to users. Let's welcome Dr. Lily Talakoob.
Hi, everybody. I'm so excited to be here to talk to you about artificial intelligence in dermatology. This is such a great topic to talk about, and it's in our lives everywhere. And I'm so excited to talk to our colleagues in the dermatology world about artificial intelligence in dermatology. Artificial intelligence and technology are certain things that is very, very hard for clinicians to adapt to. And I know it's very hard for me to adapt to as well. However, artificial intelligence and machine learning, which is what we're going to talk about today, is something that's so widespread in our worlds that as dermatologists, we need to learn about them, integrate them, and use them to our best interest to help our patients and also help our clinics. So without further ado, I'm going to talk to you today about artificial intelligence in the scope of dermatology. So I'm the founder and CEO of Dermatodor, which is a digital app and e-commerce platform that uses artificial intelligence and facial scanning and a robust teledermatology platform. I will introduce you to a couple other platforms today, of which I have no conflicts or financial interests with. So what exactly is artificial intelligence? Well, in 1955, the term artificial intelligence was coined by John McCarthy for simulating human intelligence in machines. Artificial intelligence involves multiple different scopes, and that's the broad name of it. However, AI is computer systems that perform tasks that normally require humans. Within that scope is machine learning, which is where computer systems are able to learn and adapt using algorithms and statistical models to draw inferences from patterns of data. So the pattern is 50% human input and 50% computer. Deep learning is another subcategory of machine learning by which algorithms use convolutional neuronal networks for predictive modeling, and the computational models which imitate the brain in processing data. So only 10% is about human input and 90% is actually the machine that's making the diagnostics. So current use of artificial intelligence in medicine as a whole is wide. We use artificial intelligence now for administrative uses, billing, prior authorizations, coding, and diagnostics. Medical imaging is huge for artificial intelligence. Monitoring, at-home monitoring of EKGs, PFDs, continuous blood monitoring for insulin, virtual nurses are a type, risk assessment for wound infections, health outcomes, readmission rates. And with COVID, there was a rise of telemedicine, and virtual care was becoming more of an option in the driver and development and utilization of artificial intelligence. How is artificial intelligence now used in clinical medicine? How do practitioners use it every day in clinics? Well, there's two main platforms that I'm going to talk about in dermatology, but AI in clinical medicine is widespread. IBM has the Watson's Genomic Project, which has developed treatments for over 1,000 tumors with specific genetic abnormalities that have been identified through AI. Google's cloud healthcare AI system predicts the outcomes of hospital visits and to prevent readmissions. It also shortens the amount of time that patients are kept in hospital using predictive analysis. Medtronic and IBM also have developed an insulin pump that works autonomously. IBM and Under Armour are in partnership to develop a proactive health IoT device similar to the Fitbit that you use to gather health data. There's drug discovery with artificial intelligence. The Da Vinci robotic surgery is developing an autonomous surgical robot, as well as the Google AI tool, which was launched in May of 2021 to diagnose 288 skin conditions. So how do we use AI in dermatology? Well, dermatology is a field with growing digitalization, telehealth, and informatics. But we don't quite know exactly how AI can be used, and we really haven't integrated them into our systems of practice. In a survey published in the British Journal of Dermatology, over 1,000 dermatologists were questioned. 85% of them were aware that AI could be used in derm, but only 24% had good or excellent knowledge of the subject. However, 80% of them thought AI should be a part of medical training. So AI is used in all of clinical medicine, and very little of it have we integrated into dermatologic practice. Although in a lot of medicine, it is being integrated as we speak in clinical medicine. We know very little in the world of dermatology. So today I'm going to go over AI in dermatology, the overview and the landscape, which is a wide landscape for AI, the applications of which we can use, the clinical relevance, and the barriers and risks to using. All of the topics we talk about today is based on technological feasibility. They're not validated, and we really do need prospective clinical trials in all of these systems to make sure we're doing the best by our patients. So how do we use AI in general dermatology? Well, the IBM Watson, which is a platform, has developed a system to analyze skin lesions and images for the detection of melanoma. They use 6 key points to determine the probability of melanoma using color, border irregularity, symmetry, globule and network pattern, similarity to the skin lesion images in their database, and they use it to develop a melanoma score to determine the probability of melanoma. There's others in the IBM Watson project, such as drug databases, imaging, and coding systems as well. In general dermatology, MedOptima Derm Engine has developed a virtual search tool that compares a user-submitted image with similar images in a database of thousands of pathology-labeled images gathered from dermatologists across the world. They use deep learning techniques to find features in the dermoscopic images and different patterns of a lesion that lend to a diagnostic decision. Derm Engine has a couple of other platforms called Molescope, SmartSnap, an evolution tracker, an AI clinical decision tool, as well as an e-triage system, which I'm going to show you today. Their Molescope and SmartSnap can capture a dermoscopic image in your clinic. It assigns it to a 3D body map, and then you can use the AI to, in follow-up visits, to assign that lesion to the body map, and new images can be assigned to body locations. The evolution tracker then uses that image that you've uploaded through your dermoscopy, and the individual dermoscopic lesions can be used through total body photography, and it can track the changes over time. So you can gather the total body photography, use your Dermatoscope to upload those images, and the AI system uses their tools to track the changes of those exact images over time. This is an example of the Derm Engine total body photography and evolution tracking system, where you take images of a patient, put the location in, and use the tools with the dermoscopic image to track both the location, you can track new lesions, and track those evolutionary changes in those lesions over time. So how do you take total body photography a step further? Well, you can use the AI algorithms to identify lesions. They can compare baseline to follow-up lesions and for follow-up changes over time. The AI identifies changes in the image based on shape, size, color, and also the pattern network of that dermoscopic lesion. Then you can categorize the data so you can quickly assess the change. Instead of reading notes and instead of using all the photos to compare images over time, which is what we use every single day in clinic, sorting through images and sorting through descriptions of images. Their decision support tool analysis is also uses deep learning and algorithms to help you kind of decipher those changes. This leads for us to improve workflow and efficient longitudinal tracking systems for our patients. This basically extends the walls of our practice so we can actually take images from other places, other clinics, other health systems, integrates into our electronic health records, and we can look at these changes and triage patients based on severity and who needs to be seen first. How do you take this total body photography even further? Well, not out yet, but coming in 2022, there's a virtual drone system where you can use an autonomous drone in virtual clinics, put them in outlying clinics where there's no specialist to look at these lesions and triage these patients based on severity or diagnosis. Use the drone to do total body photography, and then the AI technology can acquire all the information that you need, integrate it into your MRI, into your EMR, and then triage the patients so you can treat the patients that have the high-grade melanomas or things that you think can be melanomas or basal cells or squamous cells and see them in a timely way. So the AI tool can also assist in practitioners that aren't specialists in their clinical decision support. So uploading a dermoscopic image, for instance, of a basal cell, you can upload your image and search an entire virtual image library to find similar images like yours and use scores to help for your diagnostics into what could be malignant or not. So the AI clinical decision support can help providers look at images and compare them to see which ones can be more malignant and compare them and use a decision support tool to identify higher, more complex cases. This allows us to e-triage patients. So the provider captures the image, the AI system takes all of the images, so all of our primary cares, urgent cares, nurse practitioners, nursing homes, health systems can use these dermatoscopes to actually guide the electronic health record, enter everything in, and then the AI software can triage them based on severity, and then that can be a way where you can source this out to specialists that need to see these patients in a timely way. So you can get all of these providers to help source these patients and get them in a timely manner to clinics. So how do actually these machine learning algorithms actually diagnose, and how helpful are they to help us diagnose benign and abnormal pigmented lesions? Well, in an article in Nature Medicine, the deep learning system was tracked based on clinician confidence in these lesions. And how do we best use this to help us? Well, when clinicians are 5 out of 5 confident, such as the purple dots you see, they do better than the AI learning tracking software in diagnosing benign and pigmented lesions. If the confidence of the provider is 4 out of 5 or less, the AI system actually does a better job of diagnosing these lesions. So integration of AI can be used to help you diagnose the lesions, but also it's a very big help for the workflow and sharing of this information. You can use this as a workflow opportunity to triage your patients and give access to people that need the care in a timely way. With teledermoscopy, a specialist can receive the digital dermoscopic image through electronic transmission, and a dermatologist can use this and use AI to not just individually look at images, but sort by urgency and diagnostic type. You can then use the AI system to batch report back out to all the providers, to the health systems, to the doctors, and leverage this technology and the capacity of the specialists to have the patients come in a timely way. There's not that many more dermatologists out in the world. And the scope of dermatologists out there, they're limited. We can't see everybody. And about 2/3 of patients are being seen in primary care clinics with certain lesions that need to be biopsied or evaluated. And it's very hard to get them in with a specialist for timely care. So me as a clinician, I think to myself as a dermatologist, well, do I need these tools? Because every lesion that I see that's a pigmented lesion, I would biopsy, or that's abnormal, obviously. Or if I'm worried about a lesion, I would do a biopsy. For me, the efficacy and the help that these tools can give me is if it can diagnose or help me with the diagnostics of rashes. Because a lot of times we see rashes and it's very hard for us to kind of diagnose what they are if we don't see those rashes often enough. Can we use this technology to help diagnose rashes? Well, coming soon, that's not commercially available, there will be tools whereby the rashes can similarly be scanned in using the electronic health record, and the AI tool can help give you diagnostic support for these rashes and triage the patients and help you with the diagnostic processes. It's a decision support tool. It's not a diagnosis, but it will help clinicians, whether they're dermatologists or in primary care settings, with decision support. So AI has been used for years in cosmetic dermatology as well, not just in the general derm clinics. There's customizable skin and hair quizzes all over the Apple system and the Apple app platform. There's at-home skin analysis tools that photos and scans the skin. Our Dermatodor platform is one of them. There's Vichy Skin Consult, Neutrogena Skin 360. There's augmented reality product application platforms coming up by which the AI scans the skin and the product application tools delivers certain serums or products onto the skin. There's office-based applications such as the Visia skin analysis system, the 3D imaging, all of which I know the dermatologists have heard of, but I bet you didn't know that it was actually AI tools that were doing it. There's virtual planning softwares now for Botox and fillers. It can help tell you what the outcome of these injectables are, as well as surgical outcome modeling as well. We have automated energy-based devices, treatment devices such as laser hair removal come out, and robotic-assisted treatments such as hair transplantation that's already out on the market. So AI has infiltrated into the dermatology world. It's going to be used in general dermatology. It's going to be used in cosmetic dermatology. It's in our world right now. The Dermatodor facial AI scan uses 2 million photos of faces. We use 100,000 skin pixels to decipher facial attributes and problems where a patient can scan their skin, they can pick a concern, and the tool can give diagnostic recommendations of what to use for certain conditions, including hyperpigmentation, acne scars as well. This is the system. I'll show you a quick video of the facial scanning software. So the patient scans their skin, they answer some questions. After the facial skin analysis is done, you could see that the face scans and certain tools through artificial intelligence are used to diagnose problems. And then the AI platform, based on years of algorithms, takes the diagnostics, takes what's scanned on the skin and a history to make a diagnosis summary, as well as make treatment recommendations for patients as well. So we use these devices all over in medicine. It's being used in clinical medicine. However, AI is not a tool that's going to replace our practices in medicine. It only helps us. It helps us make diagnostics. It helps us get people in through the door. It helps people get timely care. People into a dermatologist's office that can't ordinarily be seen just based on the backlog of patients that are seen through a dermatologist. It's the decision support tools that will help us, and it will help with our workflow efficiency and provide evidence-based care. It's going to both increase patient accessibility to dermatologic care, as well as integrating with our electronic health systems and helping triage patients better. It will make us better at our jobs, and it's definitely going to improve patient outcomes. So, what are these barriers that we have in our clinical practice to using these types of technology in medicine? Well, there's obviously inherent bias in anything you do with technology. There's user bias. Who's actually seeing it and scanning it? Is it the primary care, the nurse practitioners? Is it the health systems? There's patient bias, the skin color, the age, the gender. There's data bias. Not everybody that's using a dermatoscope is using the same dermatoscope. So the images that are scanned may be different. Also, is it generalizable? Decisions made by the technology is a reflection of actually the data that's put into that technology to train the device. So it can alter based on age, gender, race, and the standardization may not be the same. Even in the correct population, their methods of obtaining data may not be comparable, such as the angle, the photo, the lighting. All of these are barriers to use and generalizability issues with using artificial intelligence. Also, the acceptance may not be there because interpretability is not there. Can the conclusion that's derived from the artificial intelligence platform be rationalized? It cannot replace us in clinical medicine. Providers will never be replaced. It can't elicit texture, signs, the Derrier sign, Nikolsky sign, whether or not there's dimpling. And many diagnoses are just a combination of clinical as well as histologic findings. Medicine is so much more than just math. We get so much from that patient encounter that the artificial intelligence cannot reproduce, such as the family input, what the patient looks like when they walk in, the gait, their mood, how they present to the clinic, all of those things that can't be input into a database and spit back out to derive data. So there's so much that the clinician has to do to derive a decision for a patient in terms of diagnostics and treatment options. There's also a huge amount of safety and ethical issues that go into artificial intelligence in dermatology. If there is an error, who is responsible for that error? Is it the software? Is it the clinician looking at that software? And it should be used as a guidance, but not a diagnostic tool, because there's so much that has to go into choosing and treating patients in a clinic. There's obviously privacy and security issues. Also, any sharing of data through mobile, through databases, poses significant risks of safety and breach of that safety. You also don't get the why of why a diagnosis was given when you see a patient. How do you explain that diagnosis? In our brains, there's so much that goes on, not just what we see in the clinic, but what that diagnosis is a combination of the history, the physical, again, how they present it in the clinic. You need that specialist to make those treatment decisions for the patients. And also who trains the AI systems and what data is used in the training and what goes into the algorithms are huge in the safety and ethics of what we do. Artificial intelligence is out there. It's in medicine. It's in the administrative side of medicine. It's in our clinics. We use it as tools, even though we don't know we're using them as tools. So it's important for us as clinicians to both learn about them as well as integrate them in their practice, because they're going to be there. I remember 10 years ago when I was starting a practice, electronic health records were just infiltrating into our medical system. It was so much reluctance into using electronic health records. We see now, only about a decade later, that's integrated in all of our medical practices. It's something we need to use, and we've used it to our advantage to both help patient care, to help communication with patients, to help communication among practices and among doctors. It's something that we were resistant to at the beginning, but we've integrated, we've learned how to use it to our best advantage. And AI is the same thing. AI is going to help us in clinical care, in diagnostics, in triaging. It's going to help increase access to care. We're very reluctant to using in dermatology right now, but it's out there. We need to learn how to use this and integrate it into our systems. It's very early in the world of AI. We haven't seen even the tip of the iceberg in what it can do. There's not a lot of FDA-approved algorithms and softwares out there that can help with diagnostics, but it will be coming up, and all of us in clinic need to learn how to use it to help our patients and help our workflows in our clinics. We're now going to go over to a question and answer. Please ask questions. Let me know what you're thinking. You can ask questions and kind of give us our insight into this. I've really enjoyed kind of bringing this together for the dermatology colleagues that I have out there. AI is a tool that I use and we need to learn how to use. And I'd love to talk more about it with anybody. You can reach out to me directly through email or reach out to me and message me. I would love to kind of share what I've done as well as share what the technology is in our dermatology world. So I'll pass it on to questions right now. Feel free to kind of chime in and ask me any questions.
Thank you so much, Dr. Telekoob. That was amazing. A great, very comprehensive presentation on artificial intelligence and dermatology. And I'm sure there's a lot of questions in the audience. Let me just start here by asking you a few questions. I personally, as a physician, I'm very interested in artificial intelligence, and I do realize the implications of that. But there is resistance, as you just said, and lack of awareness in artificial intelligence. And it's interesting that you brought up the EMR issue, because I do remember that as well. And physicians and clinicians were, I think, probably a little bit behind the eighth ball in that circumstance. And then EMR happened anyways, and we weren't able to be at the table. So what are your thoughts about physicians engaging with this? And do you think it's a done deal? Do you think it is coming?
I mean, I absolutely think it's coming. EMR is one example. Tele Dermatology, which is one of the things that I focus on now, is the second integration in technology in our practices that I know all of the clinicians in my network were resistant to using as well. Using telehealth, what platforms to use, what's safe, what's not, how do you use it? How do you screen for things? Can you see things on the screen? A lot of this technology, we're not going to be able to kind of integrate until we're forced to. And EMR was one of them. Telehealth was the second. When COVID hit, we had to use telehealth in our practices. We had to pivot really fast. So learning in retrospect, sometimes, it's my place to kind of come here and tell you, it's harder to learn in retrospect, to find the tools when you need it, rather than being more prospective and learning this technology before you absolutely need to use it. So AI is one of those. It's in our world. It's in medicine right now. As dermatologists, it's better for us to kind of tune in, listen to these talks, talk to people in the field, see what systems are out there that can help you, and then learn to integrate it, because it will be part of our programs in our clinics at some point. I don't know how soon, but at some point. It's better for us to kind of learn it now than to wait and to learn until we absolutely need to. So it is something, not every platform is going to be used for every practice, but every clinician knows where there are gaps in their care. And those are the gaps that we like to fill with technology that can help assist us in our clinics, help assist us with diagnostics. And we'll be using it in the future. So using it now and learning about it will just give you one step ahead of the game.
I think those are great points. For the clinicians who may not know that much about artificial intelligence, and you had such a great comprehensive explanation of it, how would you explain it in very layman terms?
It's basically the input of data into a system, softwares, and like I said, IBM and Dermatodor have developed these worldwide, not just United States-based, worldwide softwares where there's input of data from both clinical, histologic, dermoscopic images. The computers are trained to look at these images and make a diagnosis. And that is basically the essence of artificial intelligence, using data to have a computer system make diagnostic support or calculate algorithms to spit out information. So that's the basics of artificial intelligence. Just like when you scan, your skin and it looks at all the problems, that computer system has been programmed with hundreds of thousands of facial images that diagnose acne and acne scars, and it trains them to learn based on those skin features, what those conditions are, to better diagnose them in the future.
So for the clinician and physicians that are out there who have pivoted a lot in the pandemic and are probably very fatigued and now maybe thinking, well, now I have one more thing to learn here, what are the benefits for them personally and for patient care bringing these types of innovations into practice?
That's a great question. So I have been through all of the transitions. I've been through the EMR transition where I was based on paper and I had to switch. I was in the COVID where I had to pivot and go to telehealth within 24 hours. So I was always there through all these technology advances where we actually had to integrate. And, for the clinician, it depends on actually what type of clinic you have. If you have a clinic that you are the only dermatologist in a huge area where there's not a lot of subspecialists like you, well, you can actually branch out your practice and get cases from primary cares and outside clinics. There's that Molescope you can buy on Amazon. Your patients that have really, dysplastic nevus syndrome, you could give them a Molescope, have them buy them, have them scan the images and upload it into their portals. You could have patients that you're trying to monitor from home. If you want to branch out to other health clinics and have internists send you cases, you could do that too. If you want to use one of these facial scanning softwares to help you triage patients and give them recommendations through a store and forward telehealth platform, you can do that too. And if you are very reluctant to seeing, let's say, rashes, and rashes are not kind of something that you're really comfortable with, you could use the decision support tools coming out in the future to help scan your rashes in and help you diagnose it based on similar images that will pull up for you based on the AI software. So it kind of depends on what your practice scope is and how you want to branch out. There's a lot of derms now leaving regular clinical medicine and entering the world of just teledermatology. So they're sitting at home and just scanning cases in and seeing patients over video or store and forward platforms and looking at all these. So if you're somebody that's maybe even on the verge of retiring, but you quite can't, don't want to separate yourself from clinical medicine, that's another way you can integrate clinical medicine if you feel, that you want to retire from day-to-day patient practice. So it depends on kind of how your practice is set up.
Well, I'm just going to take that, what you just said, and pivot just spread it into one of the audience questions, Lily. And the audience question is patient satisfaction about being seen via telederm and not in person. What are your thoughts?
I agree. I see that every single day. I think COVID actually has switched our culture around a little bit. Before COVID, nobody wanted to see by telederm because they felt like they weren't getting an accurate assessment of what was happening. And definitely, I understand there is risks and inherent troubles with seeing a case on teledermatology, one of which is I can't see dysplastic nevi just by looking at my computer screen. It's just not possible. I cannot make that diagnosis looking at the screen without a dermatoscope. And obviously there's rashes that come in that are too complex to be diagnosed through just a telederm platform. Those are the outliers. The general acne, eczema, the general derm cases that come in, the seborrheic keratoses that are irritated, those are the things that could be seen. The patients now, I think if we did a poll of all the patients that are seen in dermatology clinics after COVID, I think the general consensus will be that a lot of them prefer to be seen by telederm now because it's accessible, it's easy, they don't have a waiting room, they don't have to wait, they can just log in and log out, they don't have to drive anywhere, they don't have to come back for a follow-up visit. I agree with you, before COVID, there was a very big reluctance, but I think after COVID, there's gonna be a huge cultural shift in those using teledermatology because of the way the world has turned.
I do agree with you, Lily. I think that's very true. I think there's a cultural shift, and COVID has catalyzed that, so to say. And I do think that people are much more open for telemedicine. I'm going to ask one of my own questions just as a follow-up to that, and then we're going to go to another question that's relevant as well. So my question is also, the doctor who put this question in, I think, is also asking about the interaction that we have with patients. And a lot of us go into health because we like interacting with them, and we actually get a positive feedback from just a human perspective.
I agree.
So how do you and just I'm sure you know this as well, Lily, but studies have shown, and Compassionomics was a book where they talked about this, that clinicians who spend too little time in front of patients don't get that morale and the feedback that that actually makes them want to continue to be a physician or a clinician. So how would you answer that? Will AI take that away from us?
AI will never take away from you what you want to be doing as a clinician. That's one of the greatest misconception in technology. If you want to practice medicine, there is so many patients to be seen by dermatologists. There will never be a shortage of dermatology patients for anybody. There's just not enough dermatologists out there. We're not adding residency programs. And so, I 100% agree with you. I see 500 patients a week in my clinic. So we see a lot of patients every single day. I personally see 150 to 200 of them, of that 500 every week. So, and if you told me you have another life, what are you going to come back and do in your another life? I would say I would never do anything different. I love what I do and I love my patients. I see my patients every day and I'm happy to come to work every single day. But I use the telehealth to help me. When there's a patient and we have, as you know, hundreds of patients that need prescription refills of very easy prescriptions to refill, acne medications, things that need to be filled, they haven't been seen in a year. We use that to our benefit. We say, if it's just a prescription refill, you're doing great, you sign up for a Telederm platform and you could be seen on a quick 10-minute visit, we could refill your prescription. That patient hasn't lost time in the workforce. That patient hasn't waited in the waiting room. There's no COVID exposures there. There's no, driving in, pay your copay, all that stuff. The time wasted is really key. We do those for prescription refills, or we do those for check-ins. I have a patient with a rash. For every patient with a complex rash, I see them within a week of being seen. Every single patient with a complex rash. Those patients, if they're doing better, you don't have to necessarily see them. You could just do a check-in through telehealth. So my advice to you would be use it to your advantage. See how your clinic moves. See the efficiencies of your clinic and talk to somebody in the AI world that actually knows how these efficiencies could be better used with AI, and they can help you kind of triage what you need to use in your clinic. So I use them for prescription refills, for follow-ups, for all cares. We see pediatrics. We see a lot of pediatric patients that can't be taken out of school because, our clinics are normally school hours. We use them to follow up with the kids and their parents. And a lot of times it's for reassurance only. And as well as I know, that reassurance is key to developing that patient relationship. And believe me, that patient, when they have another rash, they're going to be back in the clinic because you had such good follow-up care. So it can be used to actually enhance your relationships with patients rather than deter you from that relationships. Of course, there's people that are doing telehealth all day long. Those people are not the people that want to be in the clinics. But if you truly love what you do, which I do, it's an adjunct to my clinic, not a replacement.
I do agree with you, Lily. I think if we can just flip the perspective and not be worried about AI taking over jobs. In fact, it is an adjunct. It's it can help us. And as you said in your presentation, there's so many ways it already is, and it can potentially give us more the patient. That's what I'm excited about. That we can make a little bit more time interact with the patient, which a lot of us love to do, right? The human aspect of medicine. Okay, ask some questions from the audience here. General question: the changes during COVID have made a cross-state patient care possible in both of your. Will this continue?
That's depending on the CARES Act. Very good question. So now the question was, for people that didn't understand or hear the question, the CARES Act has allowed for clinicians in different states to deliver care across state lines. So I can see a patient, I'm not licensed, let's say in Florida, I can see a patient that's in Florida and deliver care to them, even though I don't have a license in Florida. I do think that's going to change. I think with the CARES Act and COVID, they've allowed that interstate practice of medicine. Unfortunately, although I think it's necessary, I do think that they're going to change that back. But at this point, it's still available.
Great. And we have another question from the audience. How does the MI system you described compare to the results from Molescape?
Molescape or Molescan?
I think it's Molescan. That's probably what they meant. Yeah.
I'm not familiar with that platform, so I don't know, and I don't have the data on that platform.
Okay. Let's roll over to another question here. What patient-reported symptoms do you really need to assess in person versus telehealth? Can AI substitute the need for in-person? Well, I think we already answered the second part. So maybe what patient-reported symptoms really need to assess in person versus telehealth?
The telehealth can assess a lot of symptoms. I mean, it goes through a whole algorithm of skin sensitivities, prior medical, everything you would ask on your intake form, the telehealth system asks. Everything. Previous medications, whether or not they have sensitivities in their skin, if they have allergies, it will ask for everything. That doesn't, like we said, replace the questioning of a clinician to a patient in that relationship. A lot of PIBs, we ask on paper, hey, what medications do you take? And then the patient, and they say nothing. And they walk in and they have, as you know, a full-blown drug rash. And, that clinician interaction is not going to be the same as what you read on paper. And so that's why you have to say, that clinician is absolutely necessary in the care of those patients that say, no, tell me exactly what you take by mouth every single day, any supplements, any herbs, any teas, any, all those things that we go through as a clinician that the AI system cannot decipher is what makes us so unique in providing care and not a machine, right? So it will ask the basics of what you need to know, and that's basically what's on your history. And you can actually program these systems yourself. If, for instance, if you see a lot of hair loss, you could program the system to actually ask the questions for hair loss that you need to hear, because a lot of our intake forms may not go down that path. Prior history of this, stress, telogen effluvium, pregnancy, all those different things that can contribute to hair loss, traction, all those hair care practices. So that's just one example of how you could also, put in systematic changes in your platform to get the questions out before you see the patient based on your niche as well.
Wonderful. Well, this has been a great discussion, Lily. I mean, there's so much to talk about, and I feel like we could talk for another few hours about this. We do have to, unfortunately or fortunately, wrap this up. But before I do you have any in terms of innovations in dermatology and and what people should look for next?
Yes, I'm so excited actually to be here. I think Innovation in Dermatology is such a great platform to get out, a lot of those things that we're missing in clinical practice and to hear about them. I'm excited to hear about all the pediatric cases that are coming up. I am a fond believer in seeing pediatrics. I see them all the time, and I cannot wait to hear all the other talks. But thank you for having me, and I'd be happy to answer follow-up questions either through email or through my social platforms. You can message me directly. You could email me. I'd be happy to kind of touch base and have a one-to-one with any of the viewers.
Well, we really appreciate you being here today, and thank you everyone for attending. We will roll to the next session shortly. Thank you. And also, if you have any other questions, please feel free to contact Dr. Talakoob as well as us at Medscape, and we'll make sure those questions are heard. Thank you.
Wonderful. Thank you.